The rotator cuff is a group of 4 muscles in the shoulder: your supraspinatus, infraspinatus, teres minor, and subscapularis. And to remember that, we can use the acronym SITS. So supraspinatus, infraspinatus, teres minor for the T, subscapularis for the S. We call it the rotator cuff because if you look at anatomical cadaveric studies, they literally act as a cuff around the shoulder. So we think about these muscles in isolation, but fascially how they're connected is much more working almost like a glove kind of around the shoulder that provides stability in different ways. Because the shoulder is the most mobile joint in the body, we need these lines of stability to help maintain the position of the shoulder. On the deepest level, we have passive stabilizers. That's going to be our ligaments, our labrum, our joint capsule. Those provide passive stability and allow for lubrication in the shoulder joint. Passive stability is much different than active stability because there's no contractile component. So the active stability comes from our muscular structures, which is primarily on the deepest layer, the rotator cuff. Those 4 rotator cuff muscles, they help position the shoulder and maintain the position of the glenohumeral joint through its large range of motion. So if we lose function of one of those rotator cuff muscles, we lose some of the inherent stability in the glenohumeral joint. With that being said, we see that there's a natural sort of degenerative progression of rotator cuff tears as we get older. When you're in your 20s and 30s, there's not really many rotator cuff tears seen in the research. In your 40s, we'll start to see a 10 to 20% increase in rotator cuff tears. In our 50s, we'll see roughly a 30% likelihood of someone having a rotator cuff tear. 60s and 70s, that's where we get to a 50 to 60% incidence of rotator cuff tears. Now, that doesn't mean that people are going to be coming in and needing surgery. It means that we need to strengthen those muscles and help rebuild the stability of the rotator cuff to make sure that their shoulder can go through full range of motion. As a physical therapist, there's different special tests and different exam measures that we can use to determine the severity of one's rotator cuff tear and their likelihood of surgery. But the take-home point is that these muscles act as a cuff where they work together to provide active stability to the shoulder, and that we want to make sure that they're firing those muscles because they help with positional changes of each. So the supraspinatus has a different function than the infraspinatus. The subscapularis has an internal rotation function of the shoulder. And knowing the specific function of each, knowing the anatomical location, and how these muscles activate as a group is really important for working with people who have both cervical dysfunction and shoulder dysfunction.